Did you know hypertension during pregnancy can lead to serious complications? Hypertension, or high blood pressure, is a medical condition that can emerge during pregnancy and can have significant consequences for both the mother and the baby. One type of hypertension, gestational hypertension, typically develops after 20 weeks of pregnancy and usually resolves after delivery. However, other conditions associated with hypertension can persist and may lead to more severe complications. These include preeclampsia, characterized by high blood pressure and organ damage, eclampsia, a severe form of preeclampsia that includes seizures, and HELLP syndrome, a variant of severe preeclampsia involving hemolysis, elevated liver enzymes, and low platelet count. Each of these conditions presents its own set of symptoms, risk factors, and potential complications. Understanding these conditions is crucial in managing and preventing severe complications during pregnancy. Let's dive into the first condition associated with hypertension during pregnancy: preeclampsia. Preeclampsia is a complex disorder that can occur during pregnancy and even after childbirth. It's characterized by high blood pressure and damage to vital organs, most often the liver and kidneys. So, what are the telltale signs of this condition? Well, symptoms may include high blood pressure, protein in the urine, swelling, sudden weight gain, headaches, and vision changes. But it's important to remember that these symptoms can be subtle and are often mistaken for regular pregnancy changes, making early detection a bit challenging. Now, you might be wondering, what increases the risk of developing preeclampsia? Several factors can boost the chances. These include a first pregnancy, multiple pregnancies, preexisting hypertension, obesity, and certain underlying medical conditions. It's a bit like a jigsaw puzzle with many pieces contributing to the bigger picture. And here's where things get serious. Preeclampsia can lead to complications for both the mother and the baby. For the mother, severe cases can cause organ failure, while for the baby, it can lead to premature birth and low birth weight. These complications can have long-lasting effects, making preeclampsia a condition that needs to be taken seriously. So what's the game plan? How can we tackle this condition? The answer lies in regular prenatal checkups. These visits allow healthcare providers to monitor blood pressure and other potential signs of preeclampsia. Early detection and management are key to minimizing risks associated with this condition. If you're pregnant or planning to become pregnant, it's essential to discuss any concerns or risk factors with your healthcare provider. Remember, knowledge is power. Understanding preeclampsia, its symptoms, risk factors, and potential complications can help in early detection and management. Preeclampsia can be serious, but with proper medical care and monitoring, risks can be minimized. So, stay informed, stay vigilant, and most importantly, stay healthy. Next, we're discussing eclampsia, a severe form of preeclampsia. This condition is a progression from preeclampsia and manifests in a rather alarming way, through seizures. Eclampsia is a medical condition that demands immediate attention due to its potential life-threatening implications. So what exactly is eclampsia? It's a severe pregnancy complication that evolves from preeclampsia, characterized by high blood pressure and damage to organs, often the liver and kidneys. Eclampsia takes it a step further by adding seizures to the mix. These seizures can be dangerous, potentially even life-threatening, making this condition a medical emergency. The hallmark symptom of eclampsia, as we've mentioned, is seizures. These are not ordinary seizures, but rather, they're triggered by a condition that only occurs in pregnancy. This makes it crucial for those who are pregnant to be aware of the symptoms of preeclampsia, which can progress into eclampsia if not managed effectively. Now you might wonder, how is eclampsia managed? Immediate medical intervention is the key. The focus is on controlling the seizures and managing the underlying preeclampsia, which is the root cause. This usually involves delivering the baby as soon as it's safe to do so, alongside medication to prevent further seizures and lower the mother's blood pressure. Eclampsia is a medical emergency that requires immediate treatment to protect both mother and baby. It underscores the importance of regular prenatal checkups and being aware of the symptoms of preeclampsia, as early detection and management can significantly reduce the risks. Finally, let's explore HELLP syndrome, a serious condition associated with severe preeclampsia. HELLP syndrome is one of the more severe manifestations of hypertension during pregnancy, and it's not something we can ignore. HELLP is an acronym that stands for hemolysis, elevated liver enzymes, and low platelet count. Hemolysis refers to the breakdown of red blood cells, an occurrence that can lead to anemia and other complications. Elevated liver enzymes signal liver damage, and a low platelet count can result in issues with blood clotting. The symptoms of HELLP syndrome can be quite varied and may include abdominal pain, nausea, vomiting, and other signs of liver and blood clotting dysfunction. However, these symptoms can easily be mistaken for more common pregnancy complaints, making HELLP syndrome tricky to diagnose without thorough medical examination and testing. The potential complications of HELLP syndrome are serious and can affect both the mother and the baby. For the mother, there's a risk of liver rupture, which can be life-threatening. For the baby, there's a risk of placental abruption, a condition where the placenta separates from the uterus before birth, leading to premature delivery and potential harm to the baby. With such serious potential outcomes, it's clear why early detection and treatment of HELLP syndrome are crucial. Regular prenatal checkups are key, as healthcare providers monitor blood pressure and other potential signs of these conditions. Remember, the symptoms of HELLP syndrome are often subtle and easily confused with other conditions. So if you're pregnant and experiencing any unusual symptoms, it's always best to consult with your healthcare provider. They can perform the necessary tests and evaluations to ensure you and your baby's safety. HELLP syndrome is a severe condition that needs immediate medical attention to prevent life-threatening complications. It's a stark reminder of the importance of regular healthcare visits during pregnancy and the need for awareness and understanding of hypertension and its potential impact on pregnancy. To recap, hypertension during pregnancy can lead to serious conditions like preeclampsia, eclampsia, and HELLP syndrome. These conditions carry risks and complications for both mother and baby, from organ damage to premature birth. Regular prenatal checkups play a crucial role in early detection and management of these conditions, helping to minimize these risks. It's vital to discuss any concerns or risk factors with your healthcare provider. Remember, early detection and management are key to minimizing risks associated with hypertension during pregnancy. Stay safe and take care of your health.